The ear, along with the brain, is the organ that allows the sense of hearing to occur. It has three parts that are important to hearing: the external ear, the middle ear, and the inner ear. The external ear is called the pinna. It is made of cartilage covered by skin and is attached to the side of the head. The external ear extends from the pinna through the ear canal, auditory canal, ending at the tympanic membrane, the eardrum. The ear canal is an S-shaped tube open to the outside that ends at the eardrum. This canal is lined with hair cells and cells that produce serum, earwax, and oil. Serum helps protect and lubricate the canal. In adults, the ear canal tilts downward, is slightly curved in an S shape, and is about 1 to 1.5 inches, 2.5 to 3.75 centimeters long. In children, the canal is shorter and straighter. The middle ear is a small compartment that extends from the eardrum to the oval and round windows of the wall, separating it from the inner ear. It contains the top opening of the eustachian tube and three small bones known as the bony ossicles, which are the malleus, hammer, and the incus, anvil, and the staples, stirrup. The staples is connected to the oval window. The bony ossicles are joined loosely, which allows them to move slightly in response to the vibrations created when sound waves hit the eardrum. The eustachian tube extends from the floor of the middle ear to the back of the throat, allowing pressure on both sides of the eardrum to equalize. You might have felt this as a popping sensation when you swallow or yawn, especially when traveling up or down steep hills or in an airplane. The eustachian tube normally allows secretions to drain from the middle ear to the throat. This opening from the throat to the middle ear also allows organisms in the throat to move upward, ascend, into the middle ear, which can cause otitis media, middle ear infection. The inner ear lies on the other side of the oval window. It contains the semicircular canals, the cochlea, vestibule, the end of the eighth cranial nerve. The semicircular canals are three tubes that contain fluid and hair cells that respond to the rotational movements of the head. The vestibule contains organs that sense the position of the head with respect to gravity. Both send electrical signals to the eighth cranial nerve. To help maintain the sense of balance, the cochlea is a fluid-filled organ that also contains hair cells and sensory neurons. It detects vibrations produced by sound and sends electrical impulses to the eighth cranial nerve. CN8 is called the vestibulocochlear nerve because it receives signals for balance and hearing. Hearing, auditory perception, is the main function of the ear. Hearing begins when sound waves move through the air and into the external ear canal. These waves hit the movable eardrum, creating vibrations that are transferred into the ossicles of the middle ear. The movements of these bones transmit the vibrations from the middle ear to the cochlea of the inner ear, where the sensory neurons translate them into the electrical signals that stimulate the nerve of hearing, the CN8. The impulse is then carried to the areas of the brain that allow the nerve impulses to be interpreted as sounds. Another problem in the external ear canal occurs when there is such an excessive buildup of serum that sound waves are blocked, hearing is reduced, and the patient has ear pain. For this problem, instillation of serum olytics, drugs that soften earwax, may be used, followed by irrigation of the ear. In your fundamentals and medical surgical nursing textbooks, you can review ear irrigation. These drugs are available over the counter and most often contain a carbamide peroxide, a urea plus hydrogen peroxide combination. Teach the patients to never use such a product in the ear that has drainage or discharge, because the eardrum may not be intact and the solution could enter the middle ear, causing an infection. Seromolytics, their actions are typically solvents used to break up or soften earwax so that it can be easily removed. An example is carbamide peroxide, also known as D-Brox. The most common ear problems are infection and inflammation that occur in the external ear and in the middle ear. When these problems occur in the middle ear, antimicrobial and anti-inflammatory drugs are given systemically, most often by the oral route. The actions, side effects, and nursing implications of systemic antimicrobials are discussed in chapters 5 and 6. Infections and inflammation of the pinna and the ear canal are most often managed by topical drug application because the external ear can be reached from the outside. The actions of topical antimicrobial and anti-inflammatory drugs are the same as those given systemically. Drugs that are prepared for delivery into the external ear canal are otic drugs. These are actually instilled as eardrops into the ear canal. The technique for instilling eardrops into a patient's ear: make sure that the patient's eardrum is intact. This may require assessment by the RN or healthcare provider. Never give an ear drug if there is damage to the eardrum. Read the label of the drug carefully to ensure that it is for otic use. Never put any solution in the ear that is not labeled specifically for use in ears. Verify the drug using the 9 rights of drug administration. Wash your hands and don a pair of clean gloves. Warm the eardrops to room temperature. Ask the patient to lie down with the head turned so that the affected ear is turned upward. If the patient is sitting in a chair, tilt the patient's head so that the affected ear is up. For a child younger than 3 years of age, gently pull the pinna down and back. For an older child or adult, pull the pinna up and back. Using an applicator, place only the prescribed number of drops into the patient's ear. Aim the drops onto the side of the ear canal and let them run into the ear. Insert a cotton ball into the opening of the ear canal to keep the drops from rolling out of the ear. Remind the patient to keep his or her head in this position for 2 to 5 minutes as directed to allow the drops to flow. Remove your gloves and wash your hands. Referring to the picture, which direction is the pinna being positioned? Referring to this picture, which direction is the pinna being positioned? Never place a drug into the ear canal or irrigate the ear canal if drainage is present, because the fluid can enter the middle ear and cause an infection. Do not instill a seromolytic or irrigate the ear canal in a person who is dizzy, because these actions will increase the dizziness. Reports suggest that distilled water or saline may just as effective as oil or peroxide-based solutions. Carefully review the order and do not hesitate to ask the healthcare provider if you have questions. Vision results from light moving through the eye and meeting the optic nerve, which connects to the brain. The basic anatomy of the eye: the lacrimal gland, tear gland, lacrimal sac, tear sac, and nasolacrimal duct. The eye is divided into the anterior segment and the posterior segment. The anterior segment divides into the anterior chamber and the posterior chamber. The space between the cornea and the lens is filled with a watery fluid called aqueous humor. Aqueous humor is produced by the ciliary body and flows from the posterior chamber to the anterior chamber, where it drains through the trabecular meshwork and canal of Schlemm into the blood for reabsorption by the body. Normal circulation of the fluid through the anterior chamber is important in maintaining the intraocular pressure, also known as IOP, at a normal level, between 10 and 20 millimeters of pressure. Maintenance of a normal IOP keeps the eye healthy and helps to prevent blindness. This will be important when you learn later in this chapter how drugs work to treat glaucoma. The cornea covers the eye. The clarity of the cornea is important because the cornea allows light to enter the eye. The iris is a flat, muscular ring located behind the cornea of the eye, and it has an adjustable circular opening in the center called a pupil. Pigments in the iris produce the color of your eyes, as determined by your genetic makeup. The smooth muscles in the iris control the size of the pupil to determine how much light enters the eye at any time. Impulses from the autonomic nervous system causes the muscle to either constrict the pupil, reducing the amount of light that enters the eye, or dilate it, increasing the light let into the eye. Constriction of the pupil is called miosis. Dilation of the pupil is called mydriasis. This is an easy way to remember this. Miosis, small word, small pupil. Mydriasis, large word, large pupil. General nursing considerations for ophthalmic drug therapy: always wash your hands before and after giving eye drops. Use gloves if available. Assess the patient's eye for redness, drainage, or open areas. In some cases, redness is a side effect of the eye drugs, but it also may be a sign of infection. If any new symptoms are present, notify the RN or healthcare provider before giving the drugs. To avoid contamination and reduce the risk for infection, never touch the tip of the applicator dropper to the inside of the cap. Always make sure that you are giving the correct concentration of the drug and the correct number of drops in the correct eye. Only use drugs that are specifically labeled for ophthalmic use. Remove the patient's contact lenses before giving the eye drops, and read the drug insert carefully to see whether the patient may use his or her contact lenses over the course of the therapy. If giving more than one type of eye drop, wait at least 5 minutes between instillations to avoid drug interaction. Teach the patient that his or her vision may be slightly blurry for a few minutes after eye drops are given, and slightly longer for eye ointment. To reduce risk of falls, avoid any significant activity until the blurred vision passes. Always report any sudden eye pain or sudden changes in vision to the healthcare provider immediately, because these symptoms may indicate potential for eye injury and even blindness. Make sure that you follow the directions for instilling eye drops or eye ointments into a patient's eye. After giving eye drops, ask the patient to close his or her eyes for 2 minutes. This reduces the amount of drug absorption systemically. A second option to reduce systemic absorption of the drug is to apply gentle pressure with the index finger over the tear duct in the inner corner of the eye for about 3 minutes after giving the eye drop. Some general teaching points for patients and families during topical eye drug therapy. Use only drugs that are labeled for ophthalmic use only, and never place any solution in the eye that is not properly labeled. Eye drops are typically clear, thin, liquid drugs that are supplied in a bottle specifically labeled for ophthalmic use only. Eye ointments are thick, often appear greasy, and come in a squeezable tube. The ointment remains in contact with the eye for a longer period than the eye drops do. The concentration of the drug is on the label and must be carefully compared with the drug order. Use only the prescribed number of eye drops in the eye, because too much of the drug can have adverse effects. Never share eye drops or ointments with another person to avoid eye injury and decrease risk for infection. Wash your hands thoroughly, and if available, put on clean gloves. Ask the patient to remove glasses or contact lenses before giving the eye drugs. Remove the cap of the eye drug container and place it upside down on the table to avoid contamination. Never touch the tip of the eyedropper applicator with your finger or let it touch the patient's eye. The tip should remain sterile. Ask the patient to tilt his or her head back slightly and look at the ceiling. With a tissue, gently retract the lower lid to expose the junctional sac. Teach the patient or family the proper technique for giving eye drops. Over-the-counter saline drops can be used to practice the technique and avoid wasting of the eye drug. The patient should never drive or use heavy machinery if having blurred vision after taking the drug. After giving eye drops, ask the patient to close his or her eyes for 2 minutes. This reduces the amount of the drug absorbed systemically. A second option is to reduce systemic absorption of the drug is to apply gentle pressure with the index finger over the tear duct in the corner of the eye for about 3 minutes after giving the eye drops. Always report sudden eye pain or sudden change in vision to the healthcare provider immediately, because these symptoms may indicate potential for eye injury and blindness. Teach patients to inform their healthcare provider immediately if there are any new symptoms while taking the drug. Whether related to the eye or general symptoms, teach the patient to go to the emergency department or call 911 if there is a sudden decrease or loss of vision. Technique for giving eye drops or ointments to a patient. 1. Check the name, strength, expiration date, color, and clarity of the eye drops to be instilled. If the drug is an ointment, be sure that it is an ophthalmic eye preparation and not a general topical ointment. 2. Check whether both eyes or only one eye is to receive the drug. 3. If both eyes are to receive the same drug and one eye is infected, use 2 separate bottles or tubes and carefully label each with right or left for the correct eye. That is, if insurance will pay for 2 tubes. 4. Wash your hands and put on gloves. 5. Explain the procedure to the patient. 6. Make sure the patient is not wearing contact lenses. If the patient is, ask him or her to remove them. 7. Have the patient sit in a chair while you stand behind the patient or stand in front of the patient who is sitting in a chair or over the patient who is lying in bed. 8. Ask the patient to tilt his or her head backward with the back of the head resting against you or the back of the chair and look up at the ceiling. 9. Gently pull the lower lid down against the patient's cheek, forming a small pocket. 10. Hold the container of eye drops or the ointment tube with the cap off like a pencil with the tip pointing down. A. For ointment, squeeze a small amount out onto a tissue without touching the applicator, tip to the tissue, and discard it. B. For eye drops, gently squeeze the bottle and release the prescribed number of drops onto the pocket that you have made with the patient's lower lid. Do not touch any part of the eye or the container lid with the tip of the bottle. For ointment, gently squeeze the tube and release a small amount of ointment into the pocket that you have made with the patient's lower lid. Do not touch any part of the eye or lid with the tip of the tube. 11. Gently release the lower lid. 12. Ask the patient to close his or her eye gently without squeezing the lids tightly, and roll the eye under the lid for about 2 minutes to spread the drug across the eye. 13. Without pressing the eyelid, gently blot or wipe away any excess drug or tears with a tissue. 14. Remove your gloves. 15. Recap the tube or bottle. 16. Wash your hands again. 17. Replace contact lenses as appropriate. 18. Remind patients that their vision will be blurry and not to drive until their vision clears. Together, the eye and the brain allow sight, vision. Although many problems can affect the eye and vision, those that can be managed with drug therapy are inflammation, infection, and glaucoma. Drugs for these problems are ophthalmic drugs, which come in liquid drops or ointment form. Many antimicrobial and anti-inflammatory drugs have an ophthalmic form, and their actions are the same as the systemic forms. Following directions carefully when given the ophthalmic form to avoid underdosing or overdosing. This chapter focuses on drug therapy to manage the chronic eye disorder called glaucoma, which cannot be cured but can be controlled. Although these actions and uses for these drugs are different, some nursing implications are the same for all of them. Many of the points to teach patients and families about these drugs are the same. Applying punctual occlusion, also known as digital nasolacrimal occlusion, to prevent systemic absorption. As an alternative to closing the eyes after giving eye drops, using a gloved finger, gently press and hold the corner of the eye nearest to the nose, off the tear duct for about 3 minutes to prevent the drug from being absorbed systemically. In this slide, it's showing you a correct technique for instilling eye ointment into the lower pocket of the eyelid. A technique for self-administration of eye drugs. Number 1, make sure that you check the name, the strength, the expiration date, the color, and the clarity of the eye drops to be instilled. If the drug is an ointment, be sure that it is an ophthalmic eye preparation and not a general topical ointment. Number 2, check to see whether both eyes or only one eye is to receive the drug. Number 3, if both eyes are to receive the same drug and one eye is infected, use 2 separate bottles or tubes and carefully label each with right or left for the correct eye. That is, if insurance will pay for 2, which is unlikely. Number 4, wash your hands. Number 5, remove the cap from the bottle or tube, keeping the cap upright to avoid contaminating it. Number 6, remove contact lenses if present. Number 7, tilt your head backward, open your eyes, and look up at the ceiling. Number 8, using your non-dominant hand, gently pull the lower lid down against your cheek, forming a small pocket. Number 9, hold the container of eye drops or the ointment tube with a cap off like a pencil, with a tip pointing down with your dominant hand. Number 10, for ointment, squeeze a small amount onto the tissue without touching the applicator tip to the tissue and discard it. Number 11, rest the wrist that is holding the bottle or tube against your mouth or upper lip. Number 12, for eye drops, gently squeeze the bottle and release the prescribed number of drops into the pocket that you have made with your lower lid. Do not touch any part of the eye or the container lid with the tip of the bottle. For ointment, gently squeeze the tube and release a small amount of ointment into the pocket that you have made with your lower lid. Do not touch any part of the eye or lid with the tip of the tube. 13, gently release your lower eyelid. Number 14, close your eye gently without squeezing the lids tightly, and roll your eye under the eyelid to spread the drug across the eye. Number 15, keep your eye closed for about 2 minutes. Number 16, without pressing on your eyelid, gently blot or wipe away any excess drug or tears with a tissue. Number 17, recap the bottle or tube. Number 18, replace contact lenses as appropriate. Number 19, wash your hands again. Number 20, do not drive or operate heavy machinery while your vision is blurry. Impulses from the autonomic nervous system cause the muscle to either constrict the pupil, reducing the amount of light that enters the eye, or dilate it, increasing the light let into the eye. Constriction of the pupil is called miosis. Dilation of the pupil is called mydriasis. There is an easy way to remember this. Miosis is a small word, meaning small pupil. Mydriasis is a large word meaning large pupil. Constriction and dilation of the pupil occur continuously as we adjust to varying levels of light in the environment. For example, when you walk from a dark room into the sunlight, your pupil constricts to reduce the amount of light that reaches the retina. Too much light can be very uncomfortable. When you come from the daylight into the dark movie theater, your pupils dilate to let more light in so that you can get to your seat. The posterior segment of the eye contains the retina and the optic nerve. The retina is the lining of the back of the eye. It contains special cells, rods and cones, that are sensitive to light energy and turn into electrical impulses. The posterior segment is filled with jelly-like fluid called vitreous humor, and the optic nerve in the back of the eye carries signals from the light-sensitive retinal cells into the brain, where they are interpreted as visual images. Any increase in pressure in the eye can injure blood vessels in the retina, which can damage the rods and cones as well as the optic nerve. Glaucoma is an eye disorder that results from too much aqueous humor. Aqueous humor is a fluid similar to blood plasma that is produced by the ciliary body in the eye. This fluid provides oxygen and nutrients to the cornea, the trabecular meshwork of the lens of the eye. Normally, aqueous humor flows freely in the eye, providing nutrition and removing waste products. The most common type of glaucoma by far is primary open-angle closure glaucoma, in which aqueous humor does not drain through the normal pathways. It results in a buildup of fluid and increased IOP in the anterior chamber of the eye. The fluid increases pressure in the eye, leading to damage of the retina and the optic nerve. In rare situations, a condition called acute angle closure glaucoma causes a sudden increase in IOP. This causes severe eye pain, nausea, and vomiting, and the patient may report seeing halos around lights. Acute angle closure glaucoma is a medical emergency. Any patient with symptoms of acute angle closure glaucoma should receive emergency treatment to avoid blindness. Glaucoma is a chronic disease with no cure. Drug therapy can prevent further damage and blindness and must continue for rest of the patient's life. Drug therapy for patients with glaucoma involves reducing the amount of aqueous humor produced by the ciliary body or improving drainage and reabsorption of the aqueous humor. Both treatments decrease fluid pressure in the eye, the IOP, and relieve pressure on the retina and the optic nerve. Drugs for glaucoma are typically given as eye drops instilled into the affected eye. In emergency cases of acute angle closure glaucoma, drugs may be given orally or intravenously to rapidly reduce IOP. To manage glaucoma, healthcare providers may recommend drugs from 5 classes: prostaglandin agonists, sometimes called prostaglandin analogs, beta-adrenergic antagonists, beta blockers, alpha-adrenergic agonists, cholinergic drugs, and carbonic anhydrase inhibitors, also known as CAIs. Patients who are taking drugs for glaucoma may have unequal pupil sizes. If there is any question about neurological status, contact the RN or healthcare provider for assessment. 5 classes of drugs to treat glaucoma: prostaglandin agonists, beta-adrenergic antagonists, alpha-adrenergic agonists, cholinergic drugs, and carbonic anhydrase inhibitors, also known as CAIs. A prostaglandin agonist bind to prostaglandin receptor sites in the eye, increasing the outflow of aqueous humor. They help to control glaucoma by relaxing smooth muscles in the blood vessels of the eye, which allows these vessels to dilate and absorb aqueous humor. As a result, more aqueous fluid enters the blood and less is present in the eye, lowering the IOP for many people. The prostaglandin agonists are very effective in controlling IOP. They are used only once a day and have fewer systemic side effects than any other glaucoma drugs. Examples of these drugs are bimatoprost, Lumigan, latanoprost, Exalatin, and travoprost. Never instill prostaglandin agonists into an eye that has been scratched or has an infection. Contact a healthcare provider for instructions about continuing glaucoma therapy and managing the corneal problem. The prostaglandin agonists bind to prostaglandin receptor sites in the eye, increasing the outflow of aqueous humor. They help to control glaucoma by relaxing smooth muscles in the blood vessels of the eye, which allows vessels to dilate and absorb aqueous humor. As a result, more aqueous fluid enters the blood and less is present in the eye, lowering the IOP. For many people, the prostaglandin agonists are very effective for controlling IOP. They are used only once a day and have fewer systemic side effects than any other glaucoma drugs. For the nursing implications, the nurse should check the eye carefully for any scratches or signs of trauma. If any are found, the drug should be withheld and a healthcare provider should be notified. Ensure that you are administering the correct concentration of the solution to avoid any medication error. Teach patients that they may notice changes in the color of the affected eye. Usually, it does become darker. Patients may notice a slightly darker color of their eyelid. These color changes may be a permanent result. Eyelashes on the affected eye may also grow longer and thicker. Do not attempt to use the drops in the unaffected eye to make the eyelashes match because the drug may be dangerous if used inappropriately. In addition to the general nursing consideration related to the eye drug therapy, assess the patient's understanding that glaucoma is a chronic disease that will require adherence to drug therapy to prevent decreased vision and blindness. For all patients who are taking prostaglandin agonists, it is important to check the affected eye for scratches, corneal abrasions, or other signs of trauma. Never give these drugs if there is any damage to the eye surface. The patient and family teaching: avoid using higher than prescribed doses because higher doses can reduce the effectiveness of the drug in controlling glaucoma. If you have lighter colored eyes, your iris and eyelid color can change over time, and the eyelashes can become thicker and longer. If only one eye has glaucoma, the color and lashes change will occur only in the eye that is being treated. If you have glaucoma only in one eye, do not place eye drops in the unaffected eye. The most common side effects of prostaglandin agonists are eye itching and eye redness when the drugs are first applied. In some cases, patients have a foreign body type of sensation. They feel like there is something in their eye. Over time, patients who take prostaglandin agonists may gradually but permanently develop changes in the color of the iris from lighter colors to brown. This occurs because prostaglandins increase the production of a brown pigment called melanin. The drug also causes thickening and lengthening of these eyelashes and the darkening of the skin on the eyelids as well. Another classification is beta-adrenergic antagonist. The action is that it reduces the amount of aqueous humor by binding to beta-adrenergic receptors in the ciliary body of the eye. Examples of these drugs are beta-oxalol, hydrochloride, the bet-optic, cartadolol, levobunolol, the betagan, the metipranolol, the optipranolol, the timolol, also known as the betamol. The beta-adrenergic antagonists, also called beta blockers, reduce the amount of aqueous humor produced from the ciliary body of the eye. They do this by binding to the beta-adrenergic receptors in the ciliary body of the eye. Normally, cells in the ciliary body produce aqueous humor, so blocking the action of these cells reduces the production of aqueous humor. Common beta blockers for glaucoma dosages and nursing implications are listed on a table 19.2. Be sure to consult a drug reference book for more information about these specific beta blocking agents to control glaucoma. The expected side effects for the beta-adrenergic antagonists often occur within a few minutes of instilling the drops in the eye. These include temporary blurring of the vision, slight burning or stinging and tearing of the eye. Later, the patient may notice less tear production and dry, itching, and red eyes. Beta blockers constrict the pupil. They cause miosis. It is important for patients to understand that the pupils will not dilate as easily when they go into dark rooms. The adverse reactions, the greatest risk with ophthalmic use of beta blockers occurs when the drops are unintentionally absorbed through the junctiva, the tear ducts, the nose, or other eye tissues. In fact, systemic absorption can cause the same effects seen with oral beta blockers. As discussed in the previous chapters of Chapter 9, patients can experience decreased heart rate, decreased blood pressure, and even heart failure. Systemic absorption of beta blockers can also cause bronchoconstriction and asthma symptoms. In addition to the general nursing considerations related to eye drug therapy, determine the patient's baseline vital signs. Watch for changes in heart rate and blood pressure. If the patient has respiratory problems such as asthma or chronic obstructive pulmonary disease, COPD, monitor for shortness of breath or changes in pulse oximetry. Determine whether the patient is also taking oral beta blockers to control blood pressure or other heart dysrhythmia. If so, notify the healthcare provider to ensure he or she is aware of the oral drug before giving the eye drops. Ophthalmic beta blockers may increase the risk of expected side effects and adverse effects of the oral beta blocker. Never touch the tip of the eyedropper to the patient's eye or with your finger to avoid contaminating the tip. To decrease systemic absorption of eye drops, use only the prescribed amount. After giving the drops, ask the patient to close his or her eyes for 2 minutes. This reduces the amount of drug absorption systemically. Another option to reduce systemic absorption of the drug is punctual occlusion, also called digital nasolacrimal occlusion. This means putting gentle pressure with the index finger over the tear duct in the inner corner of the eye for about 3 minutes after giving the eye drops. Caution is warranted because even with the techniques to decrease systemic absorption of the eye drops, you still must carefully monitor for adverse reactions to the drug. The patient and family teaching: do not increase the dose or use the drug more often than prescribed because excessive use increases the risk of heart and breathing problems, especially if you have asthma, COPD, or other respiratory problems. Use good lighting when reading. Use caution to enter darker rooms because the pupils will not dilate and let in more light, and it may be harder to see objects in dim light. This problem can increase the risk of falls. Avoid driving at night because your vision will be reduced. If you have diabetes, check your blood glucose more often because these drugs can mask the symptoms of hypoglycemia if the drug is absorbed systemically. To avoid contamination, never touch the tip of the applicator to the patient's eye or with your finger. And to reduce the systemic absorption of the eye drops, give only the prescribed number of drops, then ask the patient to close his or her eyes for 2 minutes or place a gloved finger over the tear duct and apply the gentle pressure for about 3 minutes, also referred to as punctual occlusion. Before giving a beta-adrenergic blocker eye drops to older patients, make sure they are not taking any oral beta blockers for a cardiac condition. If they are, notify a healthcare provider. Older adults are more likely to have cardiac and respiratory problems due to systemic absorption of eye drops. The evaluation and expected outcome of a beta-adrenergic antagonist: monitor the patient for expected side effects and adverse effects. Report significant changes in the vital signs, particularly blood pressure lower than 90/60 millimeters of pressure, or heart rate that may be less than 60 beats per minute. Watch for changes in respiratory status, including shortness of breath or wheezing, and for decreased oxygenation of the blood, a pulse oximetry that may be below 92%. An alpha-adrenergic agonist: the action reduces the amount of aqueous humor produced by the eye. They also improve the flow of the aqueous humor out of the anterior chamber of the eye. These actions reduce intraocular pressure. An example of this drug is apraclonidine 0.5% solution. The nursing implications: remind patients that these drops can sometimes make them feel that they have something foreign in their eyes and that they should not rub their eyelids. Monitor patients' vital signs on a regular basis because these drugs can cause increase or decrease in blood pressure if absorbed systemically. Report upper respiratory symptoms such as a cough, shortness of breath, sore throat, a runny nose, because these can be adverse effects of the alpha-adrenergic agonist. These drugs may be used for short-term reduction of intraocular pressure or in addition to other types of drugs for patients who do not respond to other drugs. Wait at least 5 minutes after taking these drops before using any other types of eye drops. The expected side effects commonly experienced by patients who are taking alpha-adrenergic agonists for their glaucoma include tearing, redness, blurring of vision, and burning or stinging after receiving the eye drops. Some patients may experience the sensation of a foreign body in the eye. The adverse reactions to alpha-adrenergic agonists include bradycardia, tachycardia, and a drop in blood pressure. These effects can result from giving too many drops of the drug, causing systemic absorption. Other adverse effects include allergic reaction, fatigue, and respiratory symptoms. In addition to the general nursing considerations related to eye drug therapy, assess the patient's vital signs, especially the heart rate, because the drug can cause tachycardia and bradycardia. Patients may also experience a drop in blood pressure and/or orthostatic hypotension. Let the prescriber know if the patient is taking anti-anxiety, particularly benzodiazepines, antidepressants, or sedatives, because these drugs may increase CNS effects. Carefully monitor the patient's heart rate and blood pressure for changes after giving the eye drops. Read the label carefully to confirm that you are giving the correct concentration of the drug. To decrease the risk of adverse effects, give the exact number of eye drops prescribed by the healthcare provider to the patient. Ask the patient to close his or her eyes for 2 minutes, or place the gloved finger over the tear duct and apply gentle pressure for about 3 minutes. Always wipe off any excess drug that spills on the eyelid or face to avoid systemic absorption. Read the packaging carefully because some drugs may need to be stored in the refrigerator and protected from light to maintain potency. Wear dark glasses when you are in the sunlight or other bright light conditions because your pupil will be dilated and your eye will be sensitive to light. If you have been prescribed this drug for a limited time, such as 1 week, do not continue taking it beyond the period. These drugs can continue to lower IOP below normal, which can cause additional problems with your vision. The expected evaluation and expected outcome of alpha-adrenergic agonist drugs. Short-term use, not to use more than 1 week to decrease the IOP. Carefully monitor the patient's heart rate and blood pressure for changes after giving the eye drops. Another class is cholinergic drugs. The action is increasing the availability of acetylcholine to activate specific receptors, which decreases production of aqueous humor and improves outflow of aqueous humor to decrease intraocular pressure. Examples is pilocarpine, also known as isotocarpine. Cholinergic drugs lead to decreased IOP by reducing the amount of aqueous humor produced by improving its flow. When the amount of acetylcholine is increased, the pupil becomes smaller, referred to as miosis. This increases the amount of space between the lens and the iris, allowing the aqueous fluid to flow freely and decreasing IOP. Common cholinergic drugs for glaucoma, their dosages and nursing implications are referred to in this book. Be sure to consult a drug reference book for more information about specific drugs that help to control or treat glaucoma. Cholinergic drugs should be avoided by people who have breathing problems such as asthma or chronic bronchitis. These drugs should be avoided by patients with gallbladder or liver disease. Always use the correct dose and wipe any excess drug off of the patient's skin because it can be absorbed and cause systemic effects. Use the punctual occlusion technique or ask the patient to close his or her eyes for at least 2 minutes after giving the drug. Use caution in moving from light to dark rooms. Your pupils will not dilate normally and it may be difficult to see. Use good lighting for reading and other daily activities. Remove any excess drug if it spills on your skin to avoid absorption. Report increased drooling or sweating or any difficulty breathing to your healthcare provider immediately because those symptoms may indicate a toxic level of the drug. The nursing implications in patient teaching and assessment. In addition to the general nursing considerations related to the eye drug therapy, carefully monitor the patient's vital signs, assess blood pressure, heart rate, and respiratory rate, because they may be sensitive to changes caused by the cholinergic drugs. Assess the patient for side effects expected from any drug that increases acetylcholine, including increased saliva, increased urination, and sweating. The expected side effects of cholinergic drugs include tearing, stinging, redness of the eye, and blurred vision. Cholinergic drugs cause miosis, and patients may experience difficulty with vision at night or have night blindness. As with other eye drugs discussed in this chapter, systemic side effects are possible. They include headache, increased saliva, increased urination, and sweating. Side effects are intensified if patients are prescribed an oral form of cholinergic drug. The adverse reactions are most common with systemic absorption of the drug. Examples include changes in blood pressure and abnormal heart rhythms. Other adverse effects include double vision and retinal detachment. The evaluation and expected outcomes of cholinergic drugs are report significant changes in the patient's vital signs, including decreased heart rate, less than 60 beats per minute, or trouble breathing. Symptoms such as drooling, severe sweating, respiratory failure, and severe neuromuscular weakness indicate cholinergic toxicity. Another classification is carbonic anhydrase inhibitors, also known as CAIs. The action is to lower intraocular pressure by reducing aqueous humor in the anterior chamber of the eye. Aztazolomide, Diamox, and dorzolamide, Trusopt. A carbonic anhydrase inhibitor, also known as CAI, lowers IOP by reducing aqueous humor in the anterior chamber of the eye. CAIs are the type of diuretic and are available in oral forms as eye drops and intravenously for patients who need a rapid decrease in IOPs to prevent serious optic nerve damage. Common CAIs for glaucoma, their dosages, and nursing implications are listed in this book. The nursing implications: double check allergies before giving these drugs because some may have cross sensitivities with sulfonamide antibiotics. Report any GI problems to the healthcare provider because they may be side effects of these drugs as well. Monitor electrolytes, particularly sodium and potassium, because these drugs are also categorized as diuretics. Monitor for CNS side effects such as drowsiness, fatigue, depression, and irritability. These may require a change in drugs. Notify the healthcare provider if the patient has a history of gout because these drugs may increase the uric acid levels. The nursing implications and patient teaching assessment. In addition to the general nursing considerations related to the eye drug therapy, monitor the patient for side effects and adverse reactions, particularly CNS effects, which are more likely with the oral or intravenous drugs. Ask about the report of sulfa allergies to the healthcare provider before giving any CAIs. Expected side effects of these eye drops can cause slight burning or stinging with administration. Some patients may experience a bitter or sour taste in the mouth. In rare cases, redness of the conjunctiva can occur. CAIs can cause CNS effects and must be used with caution. Patients may experience drowsiness, fatigue, and headache with oral and intravenous forms. Blood glucose levels may fluctuate when the patient is taking oral CAIs. The adverse reactions to some CAIs are related to the sulfonamide drugs and may cause an allergic reaction in patients who are allergic to any sulfa drug. The allergic response can happen even with eye drops, so notify the healthcare provider before giving a CAI to a patient with a sulfa allergy. When CAIs are taken orally or intravenously, the patient can experience a wide range of adverse effects, including neurological effects, confusion, dizziness, numbness of the hands and feet, paralysis, severe skin infections, severe electrolyte imbalances, and liver failure. The expected evaluation and expected outcomes of CAIs is decrease in aqueous humor and signs and symptoms of IOP. Assess the patient's response to the drug. Report severe side effects or adverse reactions to the healthcare provider. One side effect, a bitter or sour taste in the mouth, may affect the patient's dietary intake, and it should be monitored carefully. Shortness of breath, dizziness, hives, or itching may be a symptom of an allergic response.